What I'm going to talk about is Botox and fillers for teenagers, 20-year-olds, which is a very controversial topic. It's something that people say, what are you talking about, Dr. Lamb? You must be crazy. Why are you doing it for someone so young? That just doesn't even sound ethical or right. Why would you do that? I have that response, and I'll tell you, I don't do it frequently. Majority of my patients coming in for treatments are going to be older. However, if you think about it, I have done rhinoplasties very frequently in kids that are 17 years old. So why not some non-invasive? What is the stigma with this? Well, obviously the stigma is these treatments are designed for older people. They don't last as long initially. So what are the reasons I would do this in a younger person, let's say in their teenage and 20-some years old? Most of the teenage kids coming in here are not spoiled children that just want to have more money being thrown at me. Really, most of the younger adults coming into me that are in like teenage bracket are usually professional models. They want to look better in a competitive industry. So what I'm doing really is not making them look younger, obviously, but I'm making their facial shape look better, making things look balanced, whether their nose, their brows. Sometimes I'll use Botox to readjust things. We live in a very competitive society. We live in a society where prize is beauty. And so when someone has made a lifelong career, or at least a career out of this decision, I have done Botox and fillers for even someone as young as in the teenage years. Not commonly, but I have, and it makes sense for that individual. Of course, what's really important is when you're selecting these patients out is making sure they don't have body dysmorphic disorder, they're not obsessed with some flaw, and they're having problems. And that's a universal concern for anyone. And obviously that's a much more heightened concern when someone's doing something as unconventional as doing fillers and Botox in a much younger individual. When you get into the 20s, then it's sort of a different bracket, because at that point you have two things going on. Number one is early signs of aging, which I'll clarify in a moment. And number two is the advent of disposable income. So obviously teenagers usually are not working, et cetera, so there's much more controversy potentially there, except with some of the exceptions that I've alluded to earlier. But as we go into the 20s and 30s, especially in 30s, there's more starting some aging and things like that, more disposable income. So I think the controversy becomes much less so when we talk about 30s, and clearly beyond 40s and 50s is almost normal discussion. So really what I'm focusing today is on teenage and 20s. So the 20-something-year-olds, what I'm treating with Botox and fillers are the following circumstances. Number one, premature aging. And believe it or not, I've had patients that have had premature aging in their 20s. Number one causative agent is not smoking or meth addicts and things like that. It's due to too much sun. When someone has too much sun, they can really hurt themselves. Not only just long-term cancer of their skin, etc., especially for fair-skinned individuals, but really premature aging that can be progressive in nature. So an example of this comes to mind. I have a young lady that's mid-20s, 25 years old. She lived in the Middle East for a few years. Her parents are my patients, and really had so much volume loss and really a lot of skin problems where she looked about a decade older than herself, but a bad version a decade older. I started her on Botox, and what's really amazing is when you're dealing with young individuals with fragmented collagen, within 2 or 3 rounds, I got her collagen clean, and now she comes in maybe once or twice a year to maintain. But once you're behind the 8 ball and you've had that damage and premature aging, you really do need to start Botox early, because if you wait longer and longer, what happens is Botox, the wrinkles start going down your face. I can never fix it. I can never fix it. And I had a lady, this is a story just from last week, a patient of mine who's been with me for, she's in her 50s, she's been with me for 4 years, and she said, Dr. Lamb, why don't you fix these wrinkles down here? You never fix it. I told her, don't do it. If I try to fix it, you'll have problems. Well, she went somewhere else in November. She came back, she says, Dr. Lamb, big mistake. I went somewhere else for the Botox. They had no idea what they're doing. They try to chase these wrinkles. I couldn't even smile. I had worse wrinkles. So this is the thing. Treating wrinkles early is important. Now, most 20-year-olds don't need Botox. But if you're fair skinned, you have premature signs of aging, it does make sense to start Botox. And in the same individual, she actually had enough aging of volume loss that she justified a filler. And so fillers, as you may or may not know from my previous discussions, built over time really create good longevity, so that these are not things that you got to keep doing. But if you build it, they start to plateau, and of course you age a little bit, but you really create a really nice result with that. So This topic of Botox and fillers in younger individuals is a controversial topic. I'm not here to say that you have to subscribe to all my philosophy or ideas, but these are things that at least open the concept of why that controversy exists and how I select my patients very carefully who are very, very good candidates to have this done.